my name is Sarah Williams. I'm going to be taking care of you today. Can you verify your name and date of birth?
Philip Casey Williams, November 27th, 1991.
So nice to meet you, Casey.
It's nice to meet you too.
What can I help you with today?
I'm just here for an annual checkup.
An annual checkup? Okay. I have some questions to ask you. Do you have any allergies?
Nope.
Are you on any medications?
No.
Okay, do you have any past medical histories, like history of hypertension or high cholesterol?
I don't.
Or asthma?
No.
Okay. How about what surgeries have you had?
I had a vasectomy and LASIK.
Any complications with those?
No.
No? And how old were you when you had your vasectomy?
It was last winter. So 31.
23. And when did you have your LASIK?
That would have been 2019.
Okay. And can you tell me about your family and their medical history?
Sure. So my parents have both had non-malignant skin cancer, both removed. My mom has hypertension and eccentric tremors, and my little sister also has hypertension.
And what about your grandparents?
One set has diabetes.
Okay.
On my dad's side.
Okay.
And then on my mother's side, my grandma had Guillain-Barré.
Okay.
But no other existing.
And your sister has hypertension too?
Mm-hmm.
Okay. And have you had any issues breathing at all?
No.
What about any issues with exercising, breathing while you're exercising?
No.
Any shortness of breath?
Mm-mm.
Have you ever had asthma?
No.
What about allergies?
Just seasonal, but no.
Do you take medication for that?
Seasonally? Yes. Zyrtec.
Zyrtec? Okay. And do you know the dosage?
Whatever you get over the counter.
Okay. Have you ever had any heart palpitations?
No.
What about swelling in your extremities?
No.
Are you in any pain?
No.
Okay. Do you smoke?
No.
Have you ever smoked?
Cigars, yes.
Okay, how often do you smoke cigars?
I think the last cigar I had was a couple of years ago.
Okay. What about drinking?
Yes.
Do you drink alcohol?
I do.
How often would you say you drink alcohol?
Usually a drink with dinner.
Okay. Every night?
Sometimes. Depends on availability, if I have it or not.
Okay. What about any recreational drug use?
No.
No? Are you up to date on your immunizations?
Yes.
Perfect. Have you gotten the flu shot this year?
No.
So you're not up to date on your immunizations.
Okay. Fair.
Just kidding. Okay. All right. I am going to do a quick lung and heart exam on you, if that's okay with you.
Mm-hmm.
It's just going to entail listening to your lungs, percussing on your lungs, and palpating and all. Okay, so I'm just going to start by palpating your back. Do you feel any pain in your back?
No.
Or in your lungs or anything?
No.
No? Okay, I'm going to assess for respiratory difficulty. It looks like you are breathing just fine. Your chest is symmetrical and it's rising and falling symmetrically on both sides while you're breathing.
Okay.
Perfect. Can I see your hands, please? Circulation is good. Capri flow looks nice. No clubbing of the fingers. Great. No use of intercostal muscles to breathe or accessory muscles. Okay. And if you wouldn't mind, I'm just going to assess your lung expansion right now. So go ahead and take a deep breath. And out. Perfect. And then I'm going to go ahead and if you would say 99 as I'm moving my hands around your back.
Okay. 99. 99. 99. 99. 99. 99.
And this is just looking at your tactile fremitus on your posterior side, which is just the vibrations that are occurring while you're talking.
Okay.
So, and then I'm going to go ahead and percuss your lungs as well. This is just listening for the sounds that come off of my finger, off your lungs. It should be resonant. Okay, so now I'm going to assess for diaphragmatic excursion. So I'm just going to percuss down your back, and I need you to take a deep breath in and hold it.
Okay.
Okay? Ready? Hold it. Okay, now take a normal breath. All right, now I'm going to need you to exhale completely and hold it at the bottom. All right. Okay. I'm just going to listen to your lung sounds. Take a deep breath. Everything sounds great. So the next thing I'm going to have you do is when I listen to your lungs, I'm just going to have you repeat E every time I move the stethoscope. Okay?
E. 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 E.
Okay. And then the same thing, but I'd like you to repeat 99.
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
Okay? And then the same thing again, just repeat whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. Everything sounds great. All right, I'm going to go ahead and move this chair and have you lie down here. All right, so now I'm going to look at the front of your chest. And I'm looking for even rise and fall of your chest. No use of intercostal muscles for breathing or any other accessory muscles for breathing. Everything looks great. I'm just going to put my hands here and go ahead and take a deep breath in. Even chest expansion. Great. And I'm going to look for any kind of bruising or lesions or anything on your chest, which I don't see any. And then at this point, I would do a breast exam, which would mean I would put my hand all the way up in his axilla, and I would feel for the lymph node, or the lymph node, and then I would go down his midline here with 3 fingers and make a circular like motion So I reach right below his nipple, and then I would zigzag my way all the way up and down till I get to his sternum. And then I would repeat it on the other side. And I'm looking for any kind of breast dimpling, any asymmetry, any masses or lumps. I would examine his nipples as well and look for discharge and elasticity. All right. Now I'm going to assess for tactile firmitis. And I'm just going to place my palms on your chest and move them around. And when I move them, just say 99.
99. 99. 99. 99. 99. 99. 99.
And I'm just going to percuss on your lungs in between the intercostal spaces. Perfect. I'm going to listen to your breath sounds.
Okay.
Breathe in. All lung sounds sound clear bilaterally in all lobes. All right, so now we're going to move on to the cardiovascular portion of this exam. So I'm just going to look for your jugular veins. Go ahead and point towards me first. Yeah. Put your head up a little bit. There you go. Oh, there we go. Oh, there we go. Okay. And then go ahead and point the other way. All right. And then I'm just going to measure. Perfect. I'm just looking at your jugular venous pressure. Okay. I'm going to feel your carotid pulses. No thrills noted. I'm going to go your mid-clavicular line and palpate for your PMI. I'm going to listen to your heart. The aortic. Pulmonic. Tricuspid. And bicuspid. All right. And then I'm also going to listen to your carotid again to see if I can hear any bruits, which is just really fast blood flow. Perfect. No bruits noted. All right. We're all done. Do you have any questions?
Yep.
You can get up now. And it was so nice to meet you. And I hope you have a great rest of your evening.
Thanks. You too.